how are you doing? Okay, well, I'm Dr. Sean. I'll be doing your cranial nerve. You're my cranial nerve, I take it. Okay, because sometimes I give someone a cranial nerve and they only came in to ask me the time. It happens. Anyway, we'll start with a question, and that question is, have you noticed any changes in smell at all recently? Okay, so we like to begin this, if you ignore the question, we like to begin this with a look at your pupils. Okay, so we're looking at the alignment. Okay, so just look forward is fine, okay? Okay, so also looking at pupil size as well, okay? Okay, that's fine. So we will be making notes periodically, okay? So you had no changes in smell, it's fine, and the pupil size and alignment is fine, okay? Alright, that's excellent. So I'm going to go test your eye. So this is the Sound chart, a very famous chart you've seen before, I'm sure. And that's what we're going to test. One from arm's length apart, we're going to test these characters here in the middle, okay? So with your left eye, if you can close your left eye for me. That's right, and then you can tell me what the letters they point to, alright? Okay, here we go. Good. Okay, that's really well done, alright? So if you can now close over your right eye. Okay, and again tell me what the letters that I point to. Okay, so the right eye closed. Okay, fantastic. I'll take a step back here. Don't worry, we'll just be doing the big letters, alright, not the small ones. You're going to be fine. Okay, if you close over your left again for me. Okay, wonderful. And again, tell me what the letter is. Okay. If you're not quite sure, just guess. Here we go with the left eye closed. Fantastic. Now if you can close your right eye for me. Here we go. Okay, well done. Give your eyes a rest. It's fine. You've done really well there, okay? So I'm just going to write down how amazingly well you did there. Yep. Okay, I'm just waiting for my caffeine to kick in. Yeah, feeling a little bit tired at the moment. Hopefully I'll wake up as we get further into this examination. Alright. Good. Okay, so we'll do the pupillary reflexes, so the consensual response specifically. Okay, so I need to put my hand on your nose, that's okay. Alright, so just looking forward is fine. We're going to shine the light into one eye, look into that eye, shine the light into the same eye, look into the other eye. Okay, so we call that the direct, and then the consensual we're looking for. Good. Responses are normal. Okay, I'm going to check the other side just to be thorough. Again, looking wherever you want to is fine. Okay, consensual response is good. No issues there. Good. It's fine, one more. Good. Great, that's fine, okay. Okay, I'm just going to dim the light, okay? We'll do the swinging light test with the lights dimmed, okay? Okay, again you can look wherever you want to, alright? So I'm going to be shining the light from one eye bouncing it to now in a U-shaped pattern. Okay. Just looking at how the eyes respond, making sure that they respond in the manner that they should. Okay. Everything's looking fine now. Okay, everything's normal. Good. Okay. Put the slide back on. Alrighty, so that's that done, all done. So we're about a quarter of the way through there or thereabouts, okay? So that was a check for the relative afferent pupillary defect, alright, if you wanted to know. Probably doesn't mean a lot to you. Yeah, it's complicated. Just take my word for it. Okay, we're going to be doing the accommodation reflex test now, so constriction and convergence, sorry, as we call it, okay? So, quite simple terms, I just want you to look at the back wall and then back at the pen, it's as simple as that. Alright? So if you can pick a point on the back wall and look at that. Okay, that's great. Now look at my pen, the light at the very tip. Good. Okay, keep looking at the pen light. Okay, that's wonderful. And if you could pick another point on the back wall there and have a look at that. Okay, now look back at my pen light. Okay, now follow the light. Good. Keep looking at the pen light. Alright, now pick another point behind me on the back wall there, please. Keep looking at that. Good, now look back at my pen light. Okay, that's fine. And again, look at the point behind me on the back wall. Good, and now back at the pen. Okay, and relax, well done. Fantastic. Good. Okay, so far so good. Okay, we're going to be doing a visual field check, okay? So I'm going to be covering over my left eye. If you can cover over your right for me. And I'm going to be wiggling my fingers into your field of vision. Okay, I want you to tell me when you can see my fingers, okay? The trick is you have to be looking at my nose. Yes, you didn't think it would be that easy, did you? Alright, so if you can cover your right, I'll cover my left. Tell me when you see my fingers. Okay, good. And again, looking at my nose. Good. And now the other side, so you can cover your left. I'll cover my right till when you see my fingers. Good. Okay, well, that's fantastic. Really good stuff, alright. You're doing really well. Good, so no problems there. All four corners was fine, okay, so well done. Right, so we're going to be doing a fundoscopy. Okay, so in order for me to do this, I need to use my ophthalmoscope. So, I'm going to check in the front surface of the eye to begin. Okay. So just to let you know, I'm going to be shining a bright light into your eyes, okay? I'll do it for approximately 2 seconds, okay? So we're going to be shining a bright light into your left eye. 3, 2, 1 now. And we're done. And into your right eye. 3, 2, 1 now. And we are done, well done. Okay, just going to make a couple of notes. Okay, looking for your red eye reflex now. Okay, so again, I need to be shining a bright light into your left eye in 3, 2, 1 now. Good, and into your right eye in 3, 2, 1 now. Good, well done. Again, I'll make a note or two. I need to quickly examine the back of the eye, okay? I need to give you some eye drops to dilate the pupils, okay? This won't hurt one bit, okay? If you can just ever so slightly put your chin back for me. There we go. That's great. 1, 2, and 1, 2. There we go. Blink a few times for me. Okay. Now to do this accurately, we need to dim the lights. Okay, so just bear with me for one moment. So once again, we'll shine a bright light to your left eye in 3, 2, 1 now. And we're done, and into the right eye in 3, 2, 1 now. There we go, fantastic. Good. Okay, so we was checking the optic vessel and nerves then. And you'll be pleased to know that everything works as it should, and everything looks healthy, okay? Alright, so just a quick note there, this looks fine. Optic disc and vessels are fine. Okay. Have you experienced any double vision recently? Okay. Right, we'll do a follow the finger test. I've had a little sort out here. Going to be splitting the follow the finger test into your left side and then your right side afterwards, okay? And I'll be varying the speed between slow and fast movements, okay? What I want you to do is just keep your head as still as you possibly can and just track my fingers using your eyes, okay? Alright, so here we go then. So tracking the tips of my fingers, keeping your head still, just using your eyes. Here we go. Good. Okay. Good. Okay, well done. Keep going. And we'll leave it there. We're going to do on the right side now, okay? So again, tracking the tips of my fingers if you can without moving your head. Okay, here we go. Good. Keep going, you're doing really well. Okay. I know it's not easy. I'll leave it there. Fantastic. So you didn't seem to be having any issues there whatsoever. So that's fantastic. Okay, and did you experience any double vision when we performed that exam just now? Okay. Well, I think we're doing the trigeminal nerves. So the soft and sharp tests that we do. So we call this the fine touch sensation and the pinprick test. Okay, so we're going to start with the soft, okay? Okay, tell me first of all if you can feel this. Feel that okay? Okay. I'm going to be brushing your face on both sides. I want you to tell me, did it feel the same on both sides? Okay. Here we go. Okay, did that feel the same? Okay. Did that feel about the same? And again, did that feel the same? Okay, we have a relatively sharp object now, okay? First of all, I want you to tell me if you can feel this. I'll be very gentle, don't worry. Feel that okay? Okay, and it felt sharp relative to the soft object. Alright, so again I'm going to be brushing this across the face on both sides. I want you to tell me, does it feel more or less the same? Okay, there we go. Okay, did it feel the same? Okay. Did it feel about the same? Okay, one more time. And again, did it feel roughly the same? Okay. Thank you for that, that's good to know. Alright, so that's excellent. There we go. Okay, good. So the pinprick sensation, bite sensation, it's fine. It felt about the same on both sides, that's good. Okay, now we'll need my reflex hammer, which I've placed over there. I'll get that in a moment, but first of all I just want you to open your jaw for me. Yeah, a bit wider, that's fine. Okay, and close. Good. Okay, you can open your jaw again for me. And close. Good. Okay, open. And close. Okay, that's fine, thank you. I'm just going to get my reflex hammer. Don't worry, it won't hurt, okay? Now what I'm going to be doing is I'm going to be placing my finger on your chin and just hitting my finger with the reflex hammer, and I'll be looking for the jerk of your jaw, okay? But be very gentle, it won't hurt at all, I promise you that, okay? Alright, here we go, so I'll be placing this on the jaw, okay? That's fine, and one more time. Good, that's fine. Yeah, so we're just looking for that slight movement in the jaw there. Yeah. When you think of reflexes, you often think about the knee one. That's the most famous one. But yeah, we do actually have the reflex for the jaws as well. Who knew? Okay. Make sure it doesn't fall down the back there. Alright, so that's fine. Alright, we're doing some facial nerves now, okay, so I'm going to be asking you to pull a variety of different poses, okay, and it's all very scientific, I promise you that. I'm not here to make fun of you, okay, so what I'm about to ask you is all very serious, okay. Alright, so if you could raise your eyebrows for me and keep them there as best you can, keep them there, okay, and that's fine, and relax. Okay, if you could, in a moment I'm going to be asking you to close your eyes. I'm going to be trying to open them, and I want you to keep them closed as best you can, okay, so resist me actually trying to open them. Alright, so close your eyes for me, and resist me opening them, resist. And there we go, relax, open your eyes. All done. Okay, so that's that one done, that's fine. Okay, if you could puff out your cheeks, that's it, and don't let me press them in, okay? So don't let me press them, don't let me press them, don't let me press them. Alright, and relax, well done. Okay, if you could purse your lips, like that. Yep, it's all very scientific, keep it there. Okay, that's fine, relax, you look beautiful. And if you can give me a big teethy grin so I can see all your teeth. And keep it there. Big smile. And there we go. Fantastic. And you should be smiling too because you're doing amazing. Okay, amazing. Alright. Have you noticed any changes in your taste recently? Okay. And have you noticed that your hearing sounds about the same? So it's not louder than normal, for example. Okay, well I'm just going to be inspecting your ears now, okay, on the subject of hearing, so just stay nice and still for me. Okay. Okay. So I'm going to be checking the other one. Okay, that's fine. Thank you for that. Good. Alright, so we are most of the way through. Okay, I'm going to be doing a whispering test now. Okay, so I'm going to be covering over one ear and whispering into the other. Okay, so I'm going to whisper into the ear when I look at you. I want you then to repeat what it is I whispered. Okay, here we go. 85. Okay. 77. Okay. Park. Tree. Okay, well done, that's fine. No issues there, that's good. Alright. Okay, I'm going to be placing this on the forehead. Okay, I'm going to be giving the tuning fork a hit. It's going to make a sound like this, okay? I'm going to be asking you first of all, does it sound more or less the same through both ears, okay? Do this twice, okay? Here you go then. Okay, did it sound about the same through both sides? Okay, do this again. Again, did it sound about the same? Alright, so now for the next test I'm going to be placing this behind the ear. I want you to tell me when the sound begins and when it stops, okay? So you can say start when it starts and you can say stop when it stops, okay? Here we go. Try your left ear first and we do your right afterwards. Here we go. So tell when it starts and when it stops. Okay, all done. Other side. Okay, well done. Yeah, it's not always easy to hear, but you did really well there. Okay, so we'll put this away now. We're nearly at the end. Okay, if you can open your jaw nice and wide for me. Go and say ah. Keep saying ah. That's fantastic. Okay. And you're holding your neck gently, don't worry. Okay. And I want you to cough for me in your own time. Okay. And if you could swallow in your own time. Good. Well done. Alright, so now I want you to, in a moment, just put my hands on your shoulders if that's okay. Okay, wonderful. If you could shrug your shoulders. There we go. And now I want you to keep them up. And I want you to resist me pressing down, okay? So keep them up by your ears as best you can. Here we go. So resist, resist, resist. Okay, well done. Relax. That's good. Good bit of shoulder strength there. Okay, good. Oh, I need you to open your mouth for me once again. Okay, I want you to stick out your tongue as much as you can. Okay, that's it. Okay, wonderful, that's fine. I'll be asking you to place your tongue into your cheek and then press against my hand that I'm going to place on your cheek. That's okay. Alright, so we'll do your left side first. Placing my hand on your cheek. Now if you push your tongue into your left cheek as hard as you can. There we go, and relax, and do the same on the right side. Tongue into the right cheek as hard as you can. And relax. Well done. Fantastic. Good. Okay, so that's the end of the cranial nerve exam. You've performed fantastically throughout, no concerns or issues whatsoever. Okay, so really, really well done. Yeah, fantastic job. Okay, so you can come back in next time you want to get tested, and we'll be more than happy to do the same tests again. I'm sure you'll be absolutely fantastic a second time. Alright, take good care of yourself, and we'll see you next time. Alright.